performing an abdominal assessment now. Just for the privacy of the patient, we're just going to keep the shirt down, but in standard practice, we would expose the patient's abdomen. For starters, we'll look at the contour of the abdomen. Brett's abdomen is flat. That is normal. Some patients will have a distended abdomen, a concave abdomen, one that's rounded or even perturbulent. Those are not always normal in a patient. Further inspection will look to see if there's any lacerations, scars, that could indicate trauma or some type of surgery to remove organs. We'll also look to see if there's any lump or masses that we can visually see with our eyes before we begin to palpate or auscultate. At this time, we'll then listen with our ears using the diaphragm to listen to bowel sounds starting in the right lower quadrant. Going up to our right upper quadrant, over to our left upper quadrant, and then down to our left lower quadrant. While you're listening for bowel sounds, you want to listen for at least a total of 5 minutes if you do not hear bowel sounds, because you cannot accurately say you have not heard any bowel sounds up until that 5-minute mark. They can be hypo or hyper. If you don't hear anything, of course, further assessment needs to be done from there. From here, we will then do light palpitation, just to feel for any tenderness, swelling, or masses, starting in the right lower quadrant, moving up to the right upper quadrant, or to the left upper quadrant, to the left lower. And then from there, you'll do deep palpitations to feel some of the deeper organs from there, noting if there's any pain, swelling, or tenderness. From there, we will then do we'll check for the liver. There's 2 ways of doing it. With the patient still laying on their back, you can place one hand under their back, and then right below the rib cage, you will gently push in to feel for the liver. You want it to be firm, rounded, and smooth. Also from here, you can come up around behind them, and then with your hands cup under the rib, cup your hands up under the rib cage, which is a little bit more uncomfortable for the patient, but you can feel the liver that way, and it should be firm, smooth, and round. Next, we'll then listen to the arteries with the bell. You want to listen to hear for any bruise, which is abnormal. So we will listen. We'll be starting with the aorta, which is right here in the middle. And then you'll move a little bit further down to the renal arteries, which is on the right and left side. A little bit further down are the iliacs, so you listen to the right and the left side. And then a little bit further down, you'll have the femoral, and you'll listen to the right and left side of those as well. And you will note if there's any abnormalities with that for further inspection, okay? And that is all. Thank you.